Thank you, Mr. Chair. Your Excellencies, board members, PCC's distinguished guests, ladies and gentlemen, allow me to write on the already existing protocol. The government of Zimbabwe would like to appreciate the organizers and the chairperson for awarding Zimbabwe the opportunity to successfully host the 20th International and Inter-Ministerial Conference on South-South and Triangular Cooperation in Population and Development in October 2023, which was a high-level thematic consultation leading to ICPD 30, and was officially opened by His Excellency Dr. Emmerson Dambudzo Mnangagwa, the President of the Republic of Zimbabwe. The government of Zimbabwe acknowledges the importance of the ICPD program of action in guiding the national development policies and programs related to population, health, and gender equality. Over the past 30 years, Zimbabwe has made significant strides in various areas outlined in the ICPD agenda. Although some developmental challenges still remain, Zimbabwe reaffirms its commitment to the ICPD program of action and pledges to accelerate efforts to achieve its set country commitments at ICPD at 25 Nairobi Summit of 2019, ensuring that the rights and well-being of the individuals, especially women, girls, and marginalized groups, are prioritized in national development agendas. The government of Zimbabwe has successfully established an ICPD National Task Force to monitor and report on the progress towards fulfilling Zimbabwe's commitments made at the Nairobi Summit and make recommendations to remove bottlenecks so that sexual reproductive health and rights community maintains its momentum towards a world of rights and choices for all. Government, with the assistance from developmental partners and civil society organizations, mobilized financial resources to meet the Abuja Declaration, which states that governments should allocate at least 15% towards the health sector for the national budget. The proportion of the national budget allocated to the health was 12.7% in 2021, and family planning was allocated 2.01% of its budget. In 2022, the allocation towards health increased to 14.9%. The family planning budget allocation from the national health budget increased from 1.7% to currently 2.4% towards a target of 3% by 2026. The government of Zimbabwe signed a compact of agreement with the UNFPA, which paved the way for increased domestic funding for the procurement of contraceptives. A total of 1.6 million USD has been set aside for the procurement of contraceptives in 2024, showing an increase from 1.5 million USD worth of contraceptives procured through domestic financing in 2023. The population and housing census was conducted in April 2022 and was the first digital census in Zimbabwe. National and provincial reports were produced and disseminated, while thematic analysis is ongoing, with the 2 reports on vital statistics having been produced. This was in harmony with the United Nations principles and recommendations for the 2020 round of population and housing census revision 3. Zimbabwe has improved access to healthcare services, particularly maternal, reproductive health, and family planning services. Maternal mortality has been on the downward trend in the country due to strengthened health systems for management of emergency obstetrics complications during antenatal, childbirth, and postpartum periods. The achievements are equally attributed to reinforced community-level interventions in the provision of quality integrated family planning, sexual reproductive health rights, information, and services. The National Population and Housing Census of 2022 indicated that maternal mortality ratio was at 362 per 100,000 live births, down from 525 in 2012, while the institutional maternal mortality ratio was at 114 per 100,000 live births in 2023. The country has a robust and thriving family planning program. The modern contraceptive prevalence rate for married women increased from 59% in 2010-2011 to 67% in 2023. while the unmet need for family planning declined from 13% to 10% during the same period. Adolescent birth rate declined from 108 births per 100 women in 2019 to 87 per 1,000 live births in 2022. While the reduction is commendable, the adolescent birth rate remains comparatively high in rural areas at 161 per 1,000 live births compared to urban areas at 56 per 1,000 live births. The government, through the alignment process, passed into law the Marriage Act, that is 5.17, a law which has an important focus to deal with the scourge of child marriages. The Act recognizes that marriages can only be contracted between a man and a woman above 18 years of age, that's Section 3. Comprehensive sexual education targeting both in and out of school youth has been introduced, and youth-friendly health services and youth interact centers have been established. The education sector curriculum has been reviewed to cater for technical vocational trainings in schools and colleges so as to facilitate integration of adolescent sexuality and reproductive health issues, HIV and AIDS, and life skills in secondary and higher and tertiary education. The government has adopted an affirmative action policy which has seen an increase in the number of girls and women accessing education. The government has also guaranteed increased access to education by vulnerable people, students, through the introduction of Basic Education Assistance Module known as BEAM for basic, higher and tertiary education respectively. The government has made great strides towards the provision of comprehensive gender-based violence services to survivors of GBV through the establishment of 7 one-stop centers and safe shelters. For GBV survivors across the country, a high-level political compact on ending gender-based violence and harmful practices was developed to collectively upscale national and sub-national efforts to eradicate all forms of GBV and harmful practices by 2030. The National Disability Policy, which aligns with the ICPD commitments, was launched. The policy covers various aspects including health, education, as well as accessibility and utilization of information and services by people with disabilities. Through South-South Triangular Cooperation, Zimbabwe successfully replicated an adolescent sexual and reproductive health project from Ghana under the Partners in Population and Development South-South Triangular Cooperation Development Model. The project was focusing on the provision of youth-friendly and health services to young people, that is family planning, MHM, HTAs, STI management, and reproductive health education through outreaches in one of the new settlement areas known as Hopley in Zimbabwe capital city, Harare. Community leaders were sensitized while school teachers and peer educators were trained in reproductive health from 7 schools. Clinical services including menstrual health management and comprehensive sexuality education were provided to both schools and out-of-school youths. The project also facilitated setting up of school health clubs and the review of data collection tools to capture current changes in programming and new interventions including tracking services provision to persons with a disability. The government of Zimbabwe values the importance of the following among other strategies to achieve the goals of the Agenda 2030. 1. Strengthening institution capacity. Invest in capacity building programs to enhance the skills and expertise of government officials involved in SSTC. Develop robust systems for knowledge management, data collection, analysis to support evidence-based decision and policy making. Number 2, promote multi-stakeholder engagement. Foster collaboration with the civil society, the private sector, academia, and other non-state actors to leverage diverse perspectives and resources. Establish platforms for dialogue and partnership to facilitate stakeholder engagement in SSTC initiatives. Number 3, sustainable financing. Mobilize domestic resources and explore innovative financing mechanisms to support SSTC initiatives. Engage with the development partners, corporate world, and the private sector to secure additional funding investment. raise awareness and advocate for SSTC, conduct advocacy and outreach campaigns to raise awareness for the importance and the benefits of SSTC for sustainable development. Engage with media, opinion leaders, and policymakers to build support and momentum for SSTC initiatives. However, it is critical that we take cognizance of the challenges affecting our programming as we strive to achieve the ICPD goals and Agenda 2030. Among them is the need to improve institutional capacity, including the human resources due to high skills flight in the country. And I believe most of us, we are facing the same challenges. This affects the effective implementation of SSTC initiatives. Resource constraints. Financial limitations are a significant hurdle and heavily affect the planning, execution, and sustainability of SSTC projects. As recommendations, ladies and gentlemen, I would like to encourage all of us to strengthen our data and knowledge sharing. Effective SSTC requires robust mechanisms for data collection, analysis, knowledge sharing, which are essential for informed decision-making and tracking progress. More focuses should be on fostering project sustainability rather than short-term benefits for the currently unavailable beneficiaries. If projects focuses on capacity building of institutions as well as infrastructure, that will go a long way in the sustainability of the projects. Projects often face difficulties in maintaining momentum and achieving widespread impact beyond initial pilot phases. As I take my seat, Your Excellencies, ladies and gentlemen, let me remind you all of the famous saying that if you want to go fast, move alone. But if you want to go far, we move as a team. Teamwork is key. I thank you.